Bismillahirrahmanirrahim. Welcome back to Muhammad Salim ECG channel. Today we'll discuss atrial flutter part 5, the treatment. I'm writing the prescription. Management of atrial flutter is complex depending on duration of atrial flutter, comorbidities, underlying cause, symptoms, and age. Management of atrial flutter can be considered in a stepwise manner. You start with diagnosis of atrial flutter, assessment of duration, more than 48 hours or less than 48 hours, assessment for anticoagulation, rate or rhythm control by drugs, electricity, or ablation, and the treatment of underlying or associated diseases. The strategies for management of atrial flutter can be stroke prevention, rate control, or rhythm control. For stroke prevention, you must do risk stratification by SHAD VASC or SHAD S2 scores, and you must start anticoagulation according to the scores by warfarin or new agents. Rate control, adequate rate control defined as achievement target heart rate with rest and exercise. Rhythm control, revert to sinus rhythm either by direct cardioversion synchronized or catheter ablation. As I told you, with atrial fibrillation, there are 3 questions you must answer when you try to assess atrial fibrillation and atrial flutter at the same time. Okay, same atrial flutter like atrial fibrillation. The patient stable or unstable, if the complex wide or narrow, when atrial flutter did exactly start more or less than 48 hours. First question, the patient stable or unstable. As unstable patient must receive electrical shock, synchronized cardioversion, whatever the rhythm, regular or irregular, null or wide. Any patient with symptomatic hypotension or sign of shock should receive electrical therapy. Okay, for atrial flutter, you must use synchronized cardioversion. Start with 50 joules. Clear? 50 joules. Stable patient. If the patient is stable, of course, you will have more time to do 12-lead ECG and do further investigation. Second question, if the complex wide or narrow, to exclude possibility of pre-excitation or WW syndrome. Third question, when atrial flutter did exactly start, more or less than 48 hours. More than 48 hours, you must control rate by beta blocker, calcium channel blocker, or digoxin. Use beta blocker with cautious in case of pulmonary disease and acute heart failure, and anticoagulation must be started if the duration more than 48 hours. But if the duration less than 48 hours and the patient is stable and you must be sure about this duration, you can use cardioversion either by chemical or electrical cardioversion as we mentioned before. But remember, in real situation, we don't treat rhythm, we treat patients that have rhythm because every patient is different. So we must treat the patient, not the rhythm. Lifestyle modification, reduce alcohol and caffeine intake, stop smoking, manage stress, treat underlying conditions like sleep apnea or thyroid disease. Living with atrial flutter, with the right treatment and follow-up, many people with atrial flutter have full active lives. Regular checkups, medications adherence, and heart healthy habits are the key. Summary and call to action. Atrial flutter is a rapid abnormal heart rhythm from atria. It can cause symptoms like palpitations and fatigue. Diagnosis is made mainly with an ECG. Treatment includes medications, cardioversions, and ablation. The stroke prevention is very critical to avoid CVA. Thank you for watching. See you next lecture, inshallah.